Hi there, this is Dr. John Whitcomb talking about plasmalogens can cure a rare brain disease. Sounds like a stupid topic, but it's actually huge because here is a mistake in biology that happens very rarely that shows us an example of what happens in Alzheimer's. So if you're worried about cognitive decline in Alzheimer's, here's the example. The disease is Rhizomelic Chondrodysplasia Punctata, RCDP. Sounds like a mouthful. It is where one of the critical enzymes for making plasmalogens is missing inside of peroxisomes. And it comes in two forms, a mild form and a horrible form. And the horrible form only occurs 2 or 3 times a year in all of North America and Europe. Pretty rare. Those kids are probably going to die by age 12, so this is a catastrophe. Horrible for the family. And it turns out the kids are getting plasmalogens from their mothers while they're pregnant, but a baby's brain is growing like crazy just at the time of birth, and they need plasmalogens to help rewire and cover the wiring and insulate the wiring of the baby's brain as the brain is developing. So there's a huge demand for plasmalogens for the brain to develop, and its mom is sucked of her plasmalogens to give it into the baby. And so there is a relative deficiency at the time of birth, and it turns out that colostrum, the very first milk that moms put out, is super rich with plasmalogens, and mother's milk is very high source of plasmalogens. So breastfeeding is wonderful for a baby. Formula has 0 plasmalogens in it. So those babies have to gear up their own mechanisms internally, and obviously there are many children who have been bottle fed who seem to succeed, so it's not absolutely necessary. But the RCDP kids will fall off the growth curve in a month or 2 and very quickly get into serious trouble, start having serious seizures that can't be dealt with. They are not responsive, they don't develop normally, they can't talk, they can't communicate, they can't play. It's a disaster. Guess what happens when you give them plasmalogen supplements? It's just happened in the last 2 months to the first family, and that child was rescued. What looked like a normal baby at birth rapidly went downhill. The diagnosis was made. This child was having seizures all over the place. And a month after starting oral therapy, giving plasmalogens, making up for that inborn error of metabolism, and the child looks like it's a spectacular response. Now, this is an example where a baby has adequate plasmalogens from mother at birth and then rapidly declines because once the baby's on their own 2 feet, they can't make them because they have a genetic defect. With Alzheimer's, the opposite happens. At the other end of life, you actually reach peak plasmalogen density around age 50. But from 50 to 70, the average person loses 20% of their plasmalogen content in their brain. And we have so much redundancy and resilience, you don't necessarily have any symptoms. But if you're somebody the slope is a little steeper and you're losing it faster, you get Alzheimer's at age 74. And if your slope is a little less, you get Alzheimer's at age 81. And if your slope is a little less, you get Alzheimer's at 107. And you died at 95, so the 107 didn't affect you. We are all losing Alzheimer's after 8. We are all losing plasmalogen content of our brain and losing synapses, and our brains are shrinking. Those whose brains aren't shrinking are not getting cognitive decline. They are maintaining their plasmalogens, even if they have APOE4. If you have normal plasmalogens, you'll never get Alzheimer's. So RCDP, if you can pronounce that, you're better than me, is an example with an error of metabolism that demonstrates what happens with Alzheimer's. And it looks like we can cure RCDP. We should be able to cure Alzheimer's. You just need to keep your plasmalogens normal. So get yours measured, take your supplements. We can fix it, fix the whole ecosystem, make sure your methylation system's working. This is terribly exciting news. Dr. John Whitcomb for News and Nutrition. We can fix RCDP. I bet we can fix Alzheimer's. Proof is pending. We've got to do the long-term studies, but we're on it.